Thank you and good morning. My actual claim to fame is that I have only worked for two organizations over the past 38 years. As mentioned, 22 years with Encompass Health and then 16 years with the regional DME and infusion company. With both organizations, I was presented with the opportunity to be part of the growth of the company. Each starting with a single location in Dallas, the DME and Infusion Company eventually becoming a strong presence across the state of Texas with 20 locations, and then with Encompass Health, growing the company to serve home health and hospice patients across 31 states in 323 locations by the time I retired last year. I found that working with both companies, in particular due to our dramatic growth and expansion, that retaining your employees was the key to success. Being a best place to work is truly a philosophy that everyone in the organization has to support, starting with company leadership. Dr. Emerson brought forward the concerns related to the projected shortage of healthcare workers. The U.S. Bureau of Labor now projects the need for 1.1 million new nurses by the end of 2022 in order to avoid a shortage, as they expect 500,000 of our seasoned nurses to retire by then, and the expansion of new nursing positions continues to be on the upswing. In conjunction, the annual Homecare Salary and Benefits Annual Report put the overall 2020 turnover rate for home health at over 22%. Those in the industry know that the turnover rate, unfortunately, has continued to grow in 2021 with lingering challenges secondary to the COVID-19 pandemic. We've seen non-skilled turnover increase from 25 to 26% last year, with increases also in the nursing area, with RN turnover at 26% and LPN turnover at 34%. All the while, more attention turning towards in-home care as an ideal patient solution, and consequently, attention also turning towards home care workers across the non-skilled and the skilled sectors. As business leaders, we monitor and manage our key risk indicators. Adequate staffing always rises to the top of the list in order to support and sustain a financially healthy home care business. The key lesson I learned from my professional experience is that there is no better way to grow and sustain your business than when you employ and retain happy, dedicated employees that have a passion for your home care services. Those dedicated employees will then turn around and ensure that you have satisfied patients and family members, and also solid patient outcomes. This in turn will drive more business and more referrals to your organization and end up rewarding all your stakeholders. Actually, a very simple formula. Those in the audience also that work in the home care business know that business opportunities abound, opportunities that we want our student attendees to know about and also understand. You've heard already that home care is one of the fastest growing sectors in the healthcare industry, and we are seeing customer demand as consumers see and better understand the benefits of care at home. Medical care is being brought into the home for patients more frequently, and this is important, much quicker than ever before. With our goal of allowing seniors to age in place, we are talking about both skilled home health services and in some cases hospice care, but we are also talking about the need for non-medical caregivers to help our seniors with their activities of daily living, basically long-term support and assistance. Home health recently experienced some good news when CMS extended the moratorium on Medicare home health sequestration, thus removing the 2% cut plan for this year, giving us a little breathing room to continue to deal with the public health emergency and implementation of the 4.3% payment cut from PDGM that we realized in 2020 and again in 2021. Last year, there were over 24 million Medicare Advantage members in the U.S., over double the amount that there were in 2010, according to CMS. MA Opportunity creates an ideal payer-provider relationship with home care service providers able to prove our value to the MA health plans, who on their side are looking to reduce costs and provide better care for their members. To some extent, the Biden administration has already started to build out some of the three-legged stool that we've heard about related to home-based care. Additionally, the administration's recently proposed American Jobs Plan, as you heard Dr. Yosef mention, includes a $400 billion to expand across the home and community-based service sector, which is a big win for non-skilled caregivers. According to a May 2020 AARP article, research reveals that the U.S. is experiencing a collapse in the availability of traditionally unpaid family members. So basically, the children and grandchildren of our patients. In 2010, there were 7 potential caregivers between the ages of 45 and 64 for every 80-plus-year-old senior that was likely to need care. But by 2030, in just a few years, there will only be 4 caregivers. This is a 43% drop in available resources. As life expectancies increase and fewer of those in need have family to help them, demand for non-skilled caregiving services will explode. So our first step is to ensure that we do have staff to take on and revel in these home care opportunities. Another article, this time from salary.com, recently had the executive leaders of their companies share some minimum expectations and responsibilities that all employers will need to ensure they consider. First, it is important that an organization supports diversity, equity, and inclusion in addition to their traditional role of meeting their strategic goals and honoring their mission and values. Secondly, they strongly recommend that any manager at any company must be able to honestly and accurately answer this question from an employee: how is my pay determined? As employers, we must increase our level of transparency and let go of some of the discretion involved in making pay decisions. We will address the subject of career ladders in our next panel session, but what a great tool for managers to be able to clearly explain how pay is tied to a job position and to job duties, and what an employee can do to look forward as they expand and explore their career ladders. Lastly, they share that as companies are planning their return to pre-COVID work operations, many are finding that there may be benefits to maintaining some form of work from home options for their employees. In the home care arena, we are mostly a patient-facing workforce, but there are some employee positions, especially in the back office and in the home office roles, that could accommodate a modified work from home approach. As we talk about shoring up our workforce and ensuring that we have a full complement of staff to accommodate our patient needs, this would be some of the responsibilities that as employers we should take seriously. In addition to the global employer responsibilities, supporting our frontline workers is even more crucial today than ever before. Evidence continues to emerge that the COVID-19 pandemic has had a severe impact on the mental health and the overall well-being of healthcare workers, necessitating initiatives that improve access to mental health care for workers, including dedicated resources embedded in our employee benefits. The pandemic has already revealed the disproportionate burden of the disease among racial and ethnic minorities. This inequity has elevated the importance of diversifying hiring practices, as well as creating inclusive environments for our employees. Our responsibility as healthcare employers will be to ensure a sufficient investment and support of a workforce that reflects the composition of the national population and certainly of the diverse population that we serve on a local basis. Sustaining a focus on safety measures for our employees. In the beginning of the pandemic, many healthcare employers struggled with ensuring adequate supplies of personal protective equipment. What we have seen, fortunately, over the last year are necessary updates to PPE procurement practices and PPE use. We should be promoting COVID-19 vaccinations by making it convenient for our employees to get vaccinated and ensuring that all employees have reputable and easy to understand information about vaccines for themselves, but also for our patients and their family members. As we work hard to draw more workers to healthcare, giving our employees and our potential employees confidence in a safe workplace is non-negotiable. Given the rapid adoption of telehealth during the COVID pandemic, healthcare leaders and educators will need to continue investing in developing capacity for healthcare workers to be more proficient in delivering care through virtual modalities. Training provided while our workforce is in school and then also once they're employed. I saw a great question the other day. How is your website manner? Studies estimate that 20 to 25% of all care, not just home care, but all care, in the future could be delivered remotely. So we need to be ready with a great bedside and website manner. When we consider the disparity between the ongoing and projected nursing supply versus nursing demand, it is not about competition between healthcare entities and healthcare employers for nurses and other clinical staff in short supply, but rather I feel that it is about our responsibility as healthcare employers to ensure that we guide clinicians to the right position in the right setting at the right time. Nurses have tremendous opportunities to work across a variety of settings, and we will continue to talk about this in our conference. What we want to do now for our nurse students and for our employees is to ensure that their educational platforms prepare them to be ready for any setting. We want to consider the stage they are at in their career, their current interests, their desire to enhance technical skills and competencies, to pursue leadership or education opportunities, but ultimately to make sure that they are ready for any setting and that your setting is the right one for them now, a key ingredient of employee engagement and retention. In thinking about the home health setting, what does the ideal home care employee look like? Whether you are a student making a determination on whether home care is the right setting for you, or you're an employer ensuring an applicant is right for a home care position, being clear on employee characteristics, requirements, talents, and personality is all part of making the right decision. A passion for serving others is the first requirement. I think the last year has shined a light on that as we've seen our clinicians struggle to balance caring for patients, their families, and themselves all at the same time. Our home care employee values autonomy and working independently in the patient's home setting. You'll hear from some of our panel members what a patient care setting can actually look like. Understanding all of the state and federal regulations that govern home-based services are essential elements of a knowledgeable home care employee, and also ensures that they are competent with completing defensible documentation that not only provides the rest of the patient's care team with critical information, but also allows their employer to appropriately bill for services. Superior communication skills, a must. From communicating to patients regarding what to expect from a home health experience, to providing patient and family education, even having that crucial conversation that it might now be time to transition to hospice services. And there are some very practical elements that make up the ideal home care employee, starting with, do you have dependable transportation? Ensuring our students and potential clinicians can answer that question in the positive is also key. There are numerous ways to earn the position as an employer of choice for that ideal home care employee. Ensuring that our onboarding design is appropriately paced and not fast-tracked is step one. Step two is to continually assess the retention tools and perks that you have to offer your employees. When did you last reevaluate your continuing education programs and scholarships? Are you following through on feedback from your employees subsequent to the results from your last employee engagement survey? Step three, taking the time to sit down with every one of your staff one-on-one to ensure that you understand their professional development goals in order to design action steps for them to take and you to support. And lastly, paying it forward. Remembering what it was like when you first stepped into the home care arena and thinking through how to best support your employee, not just through competitive pay and benefits, but through a better understanding of where that high bar sits when it comes to providing an exceptional patient experience. As with any partnership, in this case, whether it is one between a home health agency and a learning institution, or the partnership between an employer with an employee, planting seeds now is the key so that we see the fruits later on in the form of successful recruitment and improved retention. You may be familiar with the saying that the best time to plant a tree is 20 years ago, and the next best time is now. We need to ensure that we are thinking strategically about this investment as we lean into our future nurses and support their growth and development at an earlier stage of the game. Unitek Learning, as you've heard from Janice and Abdel, is investing in platforms that provide accessible and innovative solutions for students while engaging employers to ensure academic content is relevant to our pain points and our workforce development needs. Whether it is teaching home care at the student level, promoting home care related certifications prior to graduation, or extending the time a student spends in a home care rotation. We need to support all of these enhanced learning approaches as employers. We also need to change perceptions so students see home health as a rewarding and viable career path when they graduate, to help them understand what it feels like to see the joy in a patient's face when you walk in the front door, to feel a sense of accomplishment when a patient is ready to graduate from services, and leaving families better equipped to care for their loved ones. So my ask of each of you is to lean into these partnerships. As a student, be willing to explore home health career options. As an employer, be willing to be creative with sponsoring solutions while making time to mentor and teach, with the ultimate goal of ensuring that every student is ready for hire and that every employee is in the right position, in the right setting, at the right time. Thank you.